Thank you for joining us today. Hope everyone is doing well. Just some quick housekeeping up top before we begin today's session. We are recording today's webcast, so if you would like to watch the replay, please reach out and we will get in touch with you later this week. We're also taking your questions today, so if you have any, you can leave them in the Q&A tab at the bottom of your screen and we will get to them towards the end of the call. All right, over to you, Farah.
Thank you, Arjun. Good morning, everyone. Thanks for joining today on Sunday in early time. So today's webinar, we want to discuss on how to manage people and business risk due to this pandemic stage. Over the past 16 weeks, we've been helping our clients navigate the stages of the pandemic cycle and have held 4 webinars so far. And we discussed on planning and responding to coronavirus, managing the impact of COVID-19 on business and people. And we discussed how to navigate the pandemic cycle and how to protect people as they come back to office. Our clients often find themselves moving into the recovery stage and looking towards a rebound. Many companies have already started working 50% of the overall number of employees in Qatar. So it is clear that is very important to discuss people risk and how it has a big impact on companies' performance and resilience. I believe this is the 5th webinar in our series, and today we'll explore the people and business risks that have been highlighted by the pandemic and how employers can identify, measure, and appropriately manage the risk by optimizing their employee health and benefits plans. We're going to have a question and answer session at the end of the presentation. Please send any questions you may have by clicking on the Q&A button on the screen. We will answer those questions at the end of the session. The presentation will be given by my colleague, Ms. Samantha Hayes. She's our senior consultant for Middle East and North Africa, who will be taking you through the presentation. So to you, Samantha.
Brilliant, thank you very much, Farah. So good morning, everyone. Very conscious it's early in Qatar, so thank you very much for joining on this Sunday morning. So my name is Sam Hayes. I'm one of the senior consultants based in Dubai, and I've been in the region for just under 3 years now. So the report that we're going to be going through is called Managing People Through Benefit Plans. So it's really looking at the wider reasons how HR can help the businesses through this global pandemic. So first of all, we're going to go through the 8 risks that we've identified. Now, some clients, you might recognize 1 or 2 of them, you might have all of them. So we're going to be going through the first 8 first, then we've got a couple of live polls, and then we've got the solutions. So again, as the HR community, how can you help the business? So we're really going to give you some practical advice today. So going to start off with the first 8 risks. So on these slides, we've got the first 4. So when we talk about business disruption, we sometimes think about cash flow, about the products of things. But when we talk about people risks, it's really understanding the employees. So at the beginning of the pandemic, some of our clients in Qatar and in the Middle East would have had to have let people go. They would have had to do an en masse redundancy and sadly let their employees go. Other clients have had to do sort of cut in pay, so maybe 50% cuts, 20% cut, etc., for maybe a number of months now. And some clients haven't had to do that at all. And as Farah mentioned, a lot of our clients are now going through the recover stage and the rebound stage. So this is kind of sort of turning back to the new normal. So slowly returning back to the office, business is starting to continue. So how can HR think about the people risks in terms of business disruption? So for some clients, you're going to be going through a large rehiring process. You're going to have to fill those employee spaces. So for some clients, you're rehiring the people that you sadly let go. For other clients, you're going to be looking at new talent. So how can you attract that new talent? How can you become the employer of choice when there is a lot of talent out there at the moment. For some clients who haven't had to let their staff go, it's how do I keep my existing staff engaged? How do I keep them in the business? Now there's the chance they might actually want to leave. So that's kind of the first risk that we're talking about. It's the people. It's keeping the people within the workforce, or it's hiring them. Second risk that we have identified is low productivity and poor performance. So for most of us, we've been working from home now for the last 3-4 months. Have you noticed a drop in the employees' productivity? Have you noticed sort of a drop in general morale and sort of engagement? So for some clients, they would have very easily noticed that maybe their benefit plans were out of scope with what was needed for this pandemic. Maybe there was exclusions, maybe there wasn't enough benefit coverage. That might have been highlighted in the last couple of months. You might have noticed that maybe there wasn't enough mental health support or telemedicine. So there might have been some solutions that were missing from your benefits. What we've also noticed, and I think what COVID-19 has really brought to the forefront, is mental health. So we know in the Middle East that mental health is still a taboo, but I think one thing COVID-19 has done is actually brought it to the forefront of businesses and HR community. We're human beings, we're meant to be social, we're meant to be interacting, but again, due to lockdown, a lot of people were isolated. For some people, they had their family around them, which was great. For others who may be single or working away from home, they might have been on their own, sort of in isolation. So again, how has that affected the overall mental health of the employee workforce? So do you need solutions? Is an EAP, an employee assistance program, that's what's required? Do you maybe need to change the culture within the company? Do you need to create that safe space for the mental health conversation that is now happening more and more within the region? Thirdly, another risk that we've identified is the unexpected financial risk. So this is kind of looking at the behaviour of the schemes. So for example, within the medical plan, you might have noticed when we look at the management information, the data, that over the last 3 or 4 months, there's kind of been a drop in utilisation. So again, we were encouraged, don't go to hospital, don't go to clinics for sort of unnecessary reasons, but people are still getting ill. So are we then suddenly going to see a spike in utilisation now that lockdown has slowly reduced? When you look at the life policies, maybe there's sort of been a spike in the temporary total disability. So people might have been claiming for that sick leave, that sick pay policy. We might have seen a spike in claims that way. And for some clients, unfortunately, there might have been a spike in death claims, again, due to the COVID nature. So again, it's kind of looking at what has changed from this year to last year. What has kind of altered that's maybe not normal within your claims risk? And then finally, on this page, we've got the rising costs. So a big thing within medical insurance is medical inflation. And we know that globally, medical inflation is roughly around 9.7%. Within the Middle East, it's around 13 to 14%. So again, the Middle East is higher than the global medical inflation. Medical inflation is driven by inflation. And we know that inflation is driven by how the global economy is working. It's linked to the stock exchange, it's linked to reinsurers, it's linked to the dollar, it's linked to the barrel of the cost of oil. And we know that all of that has been affected. We also know that insurers work off their reinsurers, and reinsurers work off the global stock exchange as well. So again, are we likely to see an increase when we come to the renewal season because of what's happening more on a global stage? So these are the first 4 risks that we've kind of identified that's occurred due to COVID-19, and then how it affects medical plans, life plans, and then sort of what the HR community needs to be concerned about. So the final 4. So the first one we've got is looking at damaged reputation. So this is twofold. So the first fold is how has what a company's done within the last 3 to 4 months being viewed as an external public. So as a company, what have you done? How has that been perceived? Has it improved your reputation? Has it damaged it? So again, do new employees want to come and work for you? What is that external reputation? But a big factor that the report talks about is the internal reputation. So again, how have employees perceived that they've been looked after during this period? Have they felt cared for? Have they felt looked after? Have they felt that they've been listened to? Is there that continual engagement, that communication that the business and HR has kind of given to their employees? Do they understand their benefits? Do they understand what they're covered for? Has there been the continual talk about wellness, engagement, community support? A big thing that we're now talking about within the HR sort of community is empathy. So again, is my business, is my employer listening to me? Are they understanding my circumstances? So this all kind of goes back to the employee centric. I, as an individual, I want to be seen as an individual. I don't want to be seen sort of as a number of an employee. I want to know that my employer is looking after me as a Sam rather than just a number. So again, think about what's been happening over the last few months. A lot of clients, we've really seen sort of them step up. And again, I've spoken to a lot of clients over this period, and the continual engagement has been fantastic. So that's really great. The sixth one we've got is safety incidences and volitations. So again, lockdown, isolation, staring at a screen all day. I don't know about anyone else, but I seem to just be on back-to-back Zoom calls. How is that affecting my general health? I'm looking at a screen all day. How does that affect my eyesight? Personally, I know my sleep patterns have been disrupted. Sleeping later, not feeling that refreshed feeling when I wake up in the morning. So we know sleep deprivation really does affect the body in a number of ways. So first of all, you've got the physical aspect. So it could be overeating, lack of hydration, generally feeling under the weather and sort of not your full potential self. So that then affects your mood and potentially depression, anxiety. So you've kind of got the mental aspects of sleep deprivation. But on the other side, we think of, well, how does that affect me doing my day-to-day job? Have you got employees that have maybe sent the wrong email, given the wrong advice? How has that changed them because potentially they weren't fully on the ball? So again, think about that as a sort of a risk for the HR. And then linking to that very nicely is sort of compromised data privacy. So when we think about this, we think about the amount of scammers. So again, in the news, we hear all about sort of scammers sort of really increased. You've got your phishing emails, the Trojans, the firewalls, etc. So how is the business, how are they sort of linking with your IT security? For me, I'm working from home, I'm off my home Wi-Fi. How secure is that? As a business, what is the business's responsibility to ensure that the IT is safe, not within the office? Again, we've now slowly got people returning to the office, but you still might have a cohort of people that are still working from home. So again, think about that. What training can you give people? What information, what education can you give them about data security? Sometimes it's very, very basic. So it's just sort of a reminder for people on what they need to do. And then finally, the final risk that we've identified is regulatory penalties. So again, we know within the Middle East that there's an awful lot of compliance. There's a lot of sort of data and security and documents that need to be sort of updated and make sure they're accurate. So again, as a company, as an HR community, how are you ensuring that your business is not at risk, is not going to be liable for any financial penalties? So these are the first 8 risks that I identified. And again, all of this detail is within the report that will be released. So we're now going to go to the first live poll. So interactive. So please highlight the one that's most important to you. So What do you consider is the main driver for health and benefits plans within your organisation? Do you think it's about improving workplace safety? Do you think that it's about improving employee morale, engagement, improving productivity and job performance, attracting and retaining employees, complying with legislation and reduce litigation, promoting corporate brand and image, or do you think it's about containing cost? So please pick one. We're going to leave it open for a few moments. And then the results will come after the next couple of slides. So thank you, Arun. So what we wanted to share with you now is a little bit of research that Mercer Marsh Benefits has conducted. So this was performed actually in January time, so just before the major COVID respond stage within the pandemic. So this is our Health on Demand employee survey, and we had just over 13,000 responses to this, so a really great sort of response. So when we asked the decision makers, what are the three main factors that are sort of the rationale for your health and wellbeing program? What we have identified is that the top three is workplace safety, coming in at 47%. We then had morale and engagement coming in at 44%. And then on third, with 42%, we had improved productivity. So this was really what the key decision makers felt that this was what was important to their employee benefits plan. So making sure people are safe, making sure it's an engagement tool, and just making sure that people are productive. So again, the lack of disengagement. So these were the main three factors. And what will be really interesting is whether the Qatar HR that are on this call, sort of whether that ties in with sort of globally. And if it doesn't, we can then discuss that. So thank you, Arun. Brilliant. So now we've come to the part of the presentation where we really want to give you some sort of practical advice, the practical solutions that HR can take to the business and sort of give solutions, give tips, give ideas. So first one is all about supporting the workforce. So when we talk about this, we talk about how can we make sure that our staff are healthy, engaged, and productive. So there are a number of ways that we can do a wellbeing solution, a wellbeing program, but three that we really want to touch on, first of all, is the virtual care. So telemedicine, as we've talked about, is sort of a big factor that's come out of COVID. Again, during lockdown, we were advised, don't go to hospital, don't go to clinics for minor things. But again, people do get ill, the body is still sick. So what are the solutions? I know that sometimes people sort of have a bit of a mental block with the virtual GP, and it's again, why do I need to see a virtual GP if I can physically go and see the doctor? And the analogy I give is a bit like internet banking. So again, internet banking is kind of a new thing that's happened sort of over the last 5 or 6 years. If it's a standard paying the bill, I'll do it on my app. But if I'm renegotiating my mortgage, I'll go and see my bank manager. So it's the same sort of solution with virtual GP. If I've got a repeat prescription, if I've got a slight rash, if I've got something minor, I can do it on my virtual app. Something major, I'm going to go and see the doctor. So again, how can HR provide that solutions to their staff? Secondly, we talk about mental health. So again, mental health is a big, big topic that's come out of COVID-19. And I suppose one great thing is that slowly clients in the Middle East are now talking about it, where before it maybe wasn't sort of a subject that was raised. I think now everyone kind of links the fact that mental health is linked to physical health. So again, if you had got depression, if you had got anxiety, it does give you physical symptoms. It gives you ulcers, migraines, headaches, sleep deprivation. So again, that does affect the body. So again, what can HR do? So there are solutions. An EAP, Employee Assistance Program, is kind of the big one that's around at the moment. It's an independent stress helpline. Employees can phone up, they can talk to dedicated counsellors about their problems. You can have Zoom calls with them, you can have telecounselling with them. There's a lot that the providers can actually do. I think what's also important is to have an open, safe space to again talk about mental health. So again, it's the business saying that this is normal, everyone can go through minor stresses, and here's the solution for you. So it's creating that space, that conversation being opened up. And then we've got the wellbeing solutions. So pre-lockdown, you could do fairs, you could do face-to-face, doctors could come in, do BMIs, know your numbers, etc. Now, obviously, those face-to-face wellness sessions are not available. They're not really being allowed. So what can clients do? A lot of things is being done virtually. So again, it's asking questions. How can I keep that engagement? What wellness sessions is valuable to my staff? What do employees value? So for some of our clients, we're doing what we call gap analysis. So it's understanding fully what you have, and then what do the employees want, and then finding those solutions. So that's kind of what we're doing within the continual engagement. Secondly, HR needs to be thinking about choosing suppliers carefully. So when we talk about this, we talk about, is our insurance companies, are our TPAs, are they the best fit? How have they responded to COVID-19? What are their exclusions? Are they adding new exclusions at renewal? How are they interacting with the brokers? How are they interacting with clients? What is their IT solutions? What is their wellness solutions? A big conversation I'm having at the moment with clients is around flexible payment terms. So that might be a topic of conversation that will happen around the renewal time. Are they offering me 90 days rather than 30 days? So again, are they secure? Are they safe? The last thing we want as your consultants is for a insurance company to go into liquidation. So again, it's looking at not just the cost when we come up to renewal, it's looking at kind of a wider support. And how are they supporting us? So again, how have they reacted to working from home? How has their IT solution sort of worked? Thirdly, we talk about communicating effectively. So what has the business done over the last 3 or 4 months? What lessons have been learned? Some of the clients I speak to have had excellent communication plans. They had things in place, so it was just very simple. For others, it was a learning curve and something that they had to work on very quickly. So again, if there was another pandemic, if we have a second wave, another lockdown, how do we continue to communicate? We did a survey back in March where we were asking some of our clients about how they communicated with their employees. So 2 points that we've pulled out is that we asked the clients, those that have telemedicine, so the virtual GP, the digital health, how often did you regularly communicate that with your staff? So when we say regularly communicate, we mean not just the one-off at renewal, but maybe every couple of months we send out a we send out a flyer, we do a WebEx. Only 18% of the clients that had a virtual GP regularly updated their staff. So again, thinking about it, these solutions you might be paying for, they might be part of the overall insurance product package. This should be communicated. Again, we really understand that virtual GP telemedicine is sort of now the future. Another interesting fact was about the employee assistance program. So roughly only a quarter of employees regularly updated their employees, the fact that they had this solution. So again, thinking about it, you might have had new staff join since the renewal. You might have had people that have missed the communication. So again, regular communication is really, really effective. One big thing that I'm reading a lot sort of in the literature that's coming out is all about empathy. So again, as an HR community, the businesses need to be showing that they're being empathetic to their staff, that they're listening, that they're again ensuring that they're seeing individuals as that individual rather than kind of the en masse. Fourth, so some of our clients are looking at centralizing decision-making. So with some of our clients, it's just been sort of the HR community that has made the decision on the renewals, which insurers, which plan designs, etc. But for some of our clients, they're actually drawing in other other business departments within the overall company. So it's really trying to understand what is the next 5, 10 years of our business. What's our risk profile going to look like in the next 3, 4, 5, 10 years? So for some of our clients, they've brought in people from the finance department, from the health and safety department, from the sort of attraction and retention department. So first of all, you're having different viewpoints. They're employees, so again, they might have a different viewpoint, but you're also getting different viewpoints of what the business is wanting. So again, maybe create a well-being strategic business plan, strategic group. Maybe have a broader spectrum of people that are involved in that renewal process. So that's what some of our clients are doing. Next page, Arun. Okay. So what we're also discussing with some of our clients is building a risk registrar. So this is kind of the practical, where are the benefits stored? Does the company have an intranet site? Is it easily available? Is it communicated where the benefits are? Does it have the network list? Does it have the exclusion list? Do people really understand what is covered and where it is saved? So again, the whole sort of thinking of this is that we don't want sort of general queries coming to you, the HR. We want sort of it diverted to sort of the core factor. So where is everything saved? So maybe think about that. Number 6, we talk about reviewing your benefits regularly. So this is actually really, really interesting. So some of the clients I've spoken to, they say, well, we reviewed our benefits last year. So that might be sort of benchmarking. That's kind of the phrase we use. But again, the world is not where we were a year ago. A year ago, you might just have wanted to be mid-market. We just really want to be middle of the road. That's kind of where our risk strategy is around our employee benefits. But again, we've changed. The world has changed. Do you need to attract employees? Do you need to keep your existing employees within sort of the organization? And the benefit plan is really a key factor to that. It's not just salaries anymore. It's the whole package that employees are thinking about. So again, do you need to become that employer of choice? Do you need to be showing better benefits than your competitors? So again, think about that when it's coming up to renewal. The world is not the same than it was previous renewal stages. You also might want to be considering what's missing. Is my psychiatric benefits, is that sort of, was it below par, mid par? Do I need to increase that? What about my virtual GPs? What was missing before? What can I enhance? What's the new topics that I need to be thinking about? Voluntary, flexible benefits. How can I kind of evolve my benefit plans into the future, into the new norm? And kind of that stage is called the rebound stage. So what needs to change to make sure that I'm now up to date in July 2020? Then we look at using risk financial optimization. So this is kind of the way of saying, how is the contract set up? So majority of schemes are under a fully insured contract. Do I need to look at different contract designs? Do I need to be looking at captives, at global underwriting, at pooling solutions, profit shares, deferred billing? So there are lots of different contract styles within the insurance world that again can be looked at pre-renewal. And then finally, it's ensuring that data is transmitted securely. So a big thing that's coming out of sort of COVID-19 is to ensure that my personal data is safe. So again, how are the insurers protecting the data? Within MMB, that's much benefits, we've got Darwin. So Darwin is our secure flexible benefit portal. It's our engagement tool that we sort of use to communicate with your employees. It links payroll, it links to the insurers, it links for sort of an administration tool, so leavers, joiners, adding on dependents. This is where the world is going. So I was listening to a great talk the other day from the head of the Darwin team, and he was saying there's no such thing as sort of a tech industry anymore. Every business has got to have tech built within it. Everyone is on their phones, everyone's got smartphones, they're on laptops. You've got the Generation X, the millennials, they are part of the workforce now. Everything has to be personalized, it has to be in your hand, on your phone. That is where the future of the world is going. So as a business, how are you going to get there? How are you going to start those small steps to really digitalize your functions? So they're the 8 practical sort of solutions. So thank you for that. What we're now going to go through is I think we've got the results. Yes. So the results of what do you consider as the key driver for health and benefit plans within your organization. So what is great to see is that coming in first place is improving employee morale and engagement. This is fantastic. So this is the 3rd one that I've done sort of within the Middle East, and this has actually always been the first one that's come out. So again, it's showing that companies, businesses, HR is really concerned about their employees as an individual. How can I ensure that their mental health, that their overall sense of morale, community, engagement, how can I ensure that we are looking after our staff? And that's really great to see. Second is improving workplace safety. So again, it's linking to sleep deprivation. It could be linking to incidences, and again, sort of those remote working, the ergonomics, those type of things. And then 3rd and 4th and 5th, improving productivity, attracting and retaining staff, and then promoting corporate brand and imaging. What's really interesting, normally, I think maybe sort of pre-COVID or a couple of years ago, we might have seen containing cost as sort of the big one. But I think this really shows sort of the evolution of employee engagement, communication that businesses are now really, really taking to heart. Thank you, Arun. So we've now got the 2nd poll, which I think is coming up. Brilliant. So did you find this webinar and the information shared valuable to you and your organization? Yes, I would like some more information. Somewhat, or no, I'm not interested in this information. You can please just click the one that's most relevant to you and your organization. That would be great. So once people have done that, so very quickly, I'm just going to touch on the report. So this report, Managing People Through Benefit Plans, will be available from today onwards. The client executives will be emailing this out to you from tomorrow. So please click on the link that it is sent to you. You go in, you download the report, and sort of everything I've been talking about is sort of within this report, but probably a lot more concise than how I'm talking. So that's all there for you. So please use this as a sort of a business case, a case study to really show the businesses what risks you feel are out there, and then how your benefit plans can really mitigate some of these risks that we've highlighted. Thank you. So we are now going to go to the, oh, sorry, we've got the results. So 90%, thank you very much, said yes, I would like some more information, and 1 said somewhat. And thank you, no one said no. So thank you very much for that. So that's great. So we are now going to go to the Q&A session. So again, at the bottom of your screen, you've got the Q&A tab. Please just put in any questions that you might have, and then we'll be able to answer that, myself and Farah, sort of over the next 20 minutes or so. So Farah, we did have a question come in pre this call. So, how do I go about ensuring workplace safety for employees returning to the office? And how can I manage anxiety around this if some of our employees are uncomfortable to go back? So Farah, what sort of conversations are you having with your clients if some of the employees are sort of uncomfortable about going back to the office?
Well, I mean, as per the regulation in Qatar, I mean, not more than 50% is allowed in the offices, and there are safety measures imposed by the government. So I think confirmation from the employer that they are following those rules and, I mean, guidelines by the government on how to maintain the safety, the distance, the social distancing in the offices itself, the sanitizers being provided to the employees, and also checking the temperature of the employees who are coming to office every day, making sure that if any employee who is showing any kind of mild, I mean, illnesses are being sent home as in sick leave, not waiting until their sickness gets worse. So I think more of a communication and what rules and what steps every employer is taking, communicating this to the employees help a lot, or give more confidence to the employees in their employer on what kind of safety measures that they are being provided to ensure that the place is safe. And of course, I mean, working is in rotation. So, I mean, when you say 50%, that means employees, I mean, most of the organization won't have to work in every day in the week. So there will be rotations, and there will be also safety measures to make sure that I mean, no one is exposed to any risk of getting the disease from any person who could be positive. Plus, I mean, in Qatar, I mean, everybody, like, we have a mobile app. So everybody has to have this mobile app showing that they are not one of those infected or the people who should be in quarantine. So having the employer checking the mobile app of an employee and not allowing anyone who doesn't have the mobile app active and showing that they are clean, they're not supposed to be in a quarantine and violating the quarantine and going out of their houses. So I think just it's more of communication to the employees on the safety measures they are taking is the most important thing.
Yeah, no, brilliant.
Yeah.
Have you had any conversations with your clients about what if someone's scared to go back to the office? What if they've got personal reasons why they don't want to return?
So, I mean, still in Qatar, for personal reasons, when you say personal reasons, let's say in case of elderly, let's say an employee who's over the age of 60, or even pregnant woman, they have the choice to work from home still and not be part of this 50%. So they have the right not to work. So also, I mean, assessing every case on its own is very important to talk to the employee, understand their own reasons. One of the reasons could be that the person could be young but taking care of their parents in the same house, who could be, I mean, old with chronic conditions, and they are high risk. So I think taking care of each employee case based on evident reason why they are more scared than the others and why they want to be given the priority of working from home than the others is very important to show support to the employees to their special cases. So those cases anyway are being exempted in most of the employers. They're not forcing the employees who have either chronic conditions, or let's say maybe a young person with cancer, let's say someone who's 35 is having cancer. I mean, those cases should be addressed separately and should be taken care of as of cases that they shouldn't be forced to come back to work, and we should be provided also the tools to be able to work from home effectively.
Yeah, brilliant.
Yeah.
So we also had another question coming in saying, what can we expect from future ways of working, and how are we preparing our workforce for the new norm?
Future ways of working. I mean, I think this topic is still in discussion. I mean, I think this is something we are exploring, all of us. I mean, with the pandemic, the concept of working from home, even if it was available in certain organizations, wasn't wasn't there in so many organizations. And in the preparation of this, when COVID-19 started, many employers took like 2-3 weeks preparing, providing employees laptops, providing them VPN access to access their servers from home. So this is the new normal, and I think the progress of getting used to this new norm is in progress still. I think, I mean, even some organizations are more advanced than others, but in some organizations, still work is in progress. And I think it has more, like, it's not only the tech factor, being able to access VPN, but also providing a work environment in the house, which could be not available for everyone. I mean, not everyone would be able to work I mean, in a separate room or like an office room and be able to concentrate on work. So I think it has more than one factor to think of, and I think it's work in progress.
Yeah. And I think a lot of companies that I'm chatting to is they're reviewing their internal policies. So again, as you mentioned, working from home, everyone's been doing it, but is that going to be maybe the new style of working? Maybe some employment contracts are going to be home-based. Maybe it's going to be sort of flexible working, 1 week in, 1 week out, hot desking. That might be a new thing that sort of comes out of this.
Yeah.
So,
I mean, also, I mean, how to manage the working hours of the employees. And this is one of the factors that, I mean, if some employees are complaining about that they're ending up working long hours because you get interrupted during the day due to family or wherever. So, and you end up like just on your laptop all day. So this is a thing that also need to be think of, and how to manage the hours of the employee, the working hours, whether employees are working more than they should, or employees who are working actually less. So how to manage this in a technical way where you're able to make sure your employees are keeping the productivity and doing their task as they should.
Yeah, right. Because so again, it's going to be how the line managers who are interacting with their employees, maybe on a daily basis, bi-weekly, how are you monitoring their workflow anymore? So yeah, definitely. Right, thank you very much. We've had a question from Zena. Do we see insurance companies adding COVID-19 as an exclusion to existing insurance plans?
Well, currently we have two types of insurers. We have insurers who had the pandemics as an exclusion of their current policy, even before COVID-19. And we had insurers who had policies where they were silent. I mean, there was no mentioning whether it's covered or not covered. And when COVID-19 came in, I mean, some companies who had the exclusion, they made an exemption for COVID-19 and some didn't. And also some insurers confirmed coverage with certain criteria to the disease. And it has also, like, we see more coverage on life policies than the medical policies. I would say in Qatar specifically, the need of having COVID-19 cover was not as much, because treatment and testing was, till now, I would say, given only by the government hospital. There was no cost as such on the medical plans, but this could soon be changing. I mean, there is a talk about private hospital being able to do the test. Nobody knows the cost, but still, I mean, it's not available. Whether when this private hospitals start giving the test, would we see more, companies adding the exclusion? I don't think so, honestly speaking, because anyway, I would say most of the insurers who have confirmed coverage for COVID-19 are the international insurers. So when an international insurer confirmed coverage for COVID-19, their concern is not specifically Qatar, because mostly their coverage is international, where there are other countries, there could be a huge cost involved. So I don't expect this to be changed with a change of situation in Qatar, or when these private sectors are allowed to do the testing and treatment, because most of the insurers who confirmed are actually international, and most of the local insurers so far have not confirmed cover, except to certain clients, clients who have negotiated their contract in a different way. So I don't expect a change, but I mean, nobody knows. I mean, if things also, if COVID-19 become in a like got worse, let's say, we have a more rise in numbers, we have more cost involved, everything could change. But as per the current information, the current progress, I don't see this happening.
Yeah. And I think this really sort of highlights Azina. So if you are a Mercer Marsh benefit client, again, reach out to your client executive, make sure that you've got it in writing. Currently, what is your insurer covering? So Farah, I know a lot of work sort of pre-renewal is looking at benchmarking. So what is in the exclusions, and then ensuring that then the renewal contracts, that the insurers aren't adding anything in. I know that that's something you and your team are very active in the pre-renewal stage. So yeah, no, that's good. Right, so thank you very much. We've had a question from Rahul. Do you recommend having all of your employees be tested for COVID-19s? What are the pros and cons for this? So I've actually, I'll take this, Farah. So I've been involved in a lot of global calls. So I'm part of the Middle East, I'm part of the global calls that we have within Mercer Marsh. So I've been chatting to a lot of my Chinese colleagues, because obviously China is probably 3-4 months in advance of us. And this conversation actually come up, and we've spoken about this a lot. In an ideal world, we would test everyone every single day. So again, as soon as you walk into the office, you get tested, and it's that regular monitoring. The practical aspects of that, though, is that you can't really do that. You've got the costs. It's the whole invasion of the stick up the nose every single day. And if you test someone on a Monday, they might interact with someone that day, and sadly by the evening they might have caught it. So just having a negative test doesn't prevent the future of catching it later on. So we're kind of really saying that it's down to personal responsibility. So again, Farah, you've talked about having the app. So again, if you have caught it, or you've been in contact with someone, you've got that app. But it's also personal responsibility. So if you're showing symptoms and signs, you let your manager know, you let the HR team know. You don't go into the office if you kind of think that you are. So that's kind of some of the conversations that we're having. Have you had sort of any conversations about being tested?
Not really, because I mean, in Qatar, testing is not done unless you have had symptoms, or you've contracted with someone who is positive. Like, let's say your partner or like your husband is positive, and then you'll get tested, or your colleague in the office who's been, like, you're dealing with in very regular basis has been positive. But I mean, testing is not available for anyone. It's not like you just walk in and have the test done every day or whenever you want. First of all, it's provided so far for free, but it has a cost by the government. So the government is bearing the whole cost. So it can be open. And even if you do that, as you mentioned, even let's say private sector in the future start providing the test, they're only providing it for certain criteria. It will not be offered for anyone who just walks in. So the criteria would be also showing symptoms or contracting with someone who's been positive. So I mean, can you imagine if every employer goes for like testing? I mean, it's going to be a huge cost on insurance, on employers, on the people who pay for it from their own pocket. And as you said, it's not really effective, because you could be negative in the morning, in the afternoon you meet someone who's like positive, and in the evening you're actually sick. So how effective it is, it's not really effective. Doesn't give you any guarantee that your employee is negative or free of COVID-19, because he could get it in any second, and it's a personal responsibility. And that's why raising the awareness on how to protect yourself, your family, stay safe, do not keep the social distance, do not go out unless necessary. This kind of awareness talks to the employees are very important. And also reporting when sick. I mean, we have seen few cases where employees have, like, especially because they're working from home, have not reported that they've been sick, because they were afraid it could be COVID-19. So, I mean, I think encouraging talking to the employer and let them understand that there will be no negative, results of being sick. I mean, it's a very natural thing. So I think raising awareness and having a regular talk with the employee is the most important.
Yeah, it's reiterating that you need effective communication. You need to engage. You need to show that empathy to your workforce. Yeah, completely.
Yeah.
Brilliant. Right, so we just had one final question that came in, and probably quite prevalent to the time of year that we are, sort of pre-renewal for all the Januaries. So one of the questions was, how can I manage the cost of my medical insurance for my employees? So Farah, what are you and your team sort of revving up towards sort of the pre-renewals?
So what we have, I mean, of course, I mean, even before COVID-19, we always have a pre-discussion with the clients on their renewals and what is their target, what are they looking to add, or what is, if there's a discussion cost savings, is how much is the target out of that. So we, in the current situation where some business has been affected by the current situation, we had specific targets from clients on savings in their insurances, and not specifically only on medical. So what we're looking at, I mean, other than the normal review of the claims history, looking at the performance, and I mean, we're trying to also look at the performance in the past 3-4 months where, I mean, claims have been less for sure. But still predicting the future is still on question, whether people are more encouraged to go back to normal, and repeated visitation will be there or not. So such discussion, understanding every employee's performance, that's one. Second, discussing options of coverage, what could be not really a priority benefit, what can we help on prevent abuse of certain situations or certain benefits. Certain discussion are going on with clients. I think the main thing that has been changed when COVID-19 started is that clients are interested in seeing more options. So those clients who had benefits that I would say a high value benefit, but they have not been utilized, they are ready to let go some of those benefits or restrict them more if they're not being utilized, if they're not being benefiting the employees much. So we're looking, as I said, it's more of benchmarking, claims review, as well as understanding clients' needs for the renewal. And the market, we have more hungry insurers, and we have client insurers who have, I would say, standard pricing that have not been affected by the current situation. And we have some insurers who have increased their rates. So we're trying to approach as many insurers as we could, explore options of coverage based on the information of claims as well as clients' needs.
Brilliant. So it sounds like it's a personal conversation. What is
exactly
going through? What are your risks, and how can we help to mitigate those? Yeah.
Exactly.
No one client is the same. I think that's kind of thing.
No, yeah.
Brilliant. Well, I think that's all the questions that have come through. So unless there's anyone else with a final question, I just want to say thank you very much, Farah, for having this with me today. It's been a pleasure.
Thank you so much. Thanks a lot.
Brilliant. And everyone on the call, thank you very much for taking time out, I know early on a Sunday morning in Qatar. So thank you. And again, the reports will be emailed to you early this week from your client executives. So please feel free to read it and then reach out if you have got further questions.
All right. Thank you, everyone. Thank you, Samantha.